Okay, so today I'm going to show you what I do when a patient breaks one of their front teeth clean off at the gum line with probably an old crown post in it. And they're ready for an implant, but we need to do the planning, and then we need to temporarily cement their post back in. So this is a good way to buy patients time. It's pretty strong and it can last a long time. When I end up going to extract the teeth, sometimes I have a very hard time getting the crown off. So I get a paper clip and I get one that has some little grooves in the side of it, and then I cut a piece, and then I'm going to create a loop. Okay, I create a loop just like that. I might bend it back a little the other way here. And this part's gonna go, I'm gonna drill a post hole in the tooth, and I'm gonna try this in, and then I'll cut it more if I need. And then I will drill out the core on the inside of the crown and get it to fit passively over this. And once everything fits, then I'll cement this in place with paracord inside the tooth. And then I'll put paracord in the crown also. I'll sandblast the inside of the crown, and then I'll cement it on over top. And it's super strong. Okay. Okay, so this is a very common situation. Patient comes in and they've broken their tooth off at the gum line, and it had a root canal and a post and a crown. Show the crown over here. So there's the crown that came out. There's my post that I made that I showed you before that's been sterilized. And so I'm gonna hollow this all out. I'm gonna remove the post and clean out the whole inside, and then we're gonna sandblast it. And this part of the tooth, I'm going in with the round burr on a slow speed handpiece and just cleaning out the inside of the canal, removing any decayed or soft tooth structure. I'm just cleaning it out because I want decent tooth structure remaining. And then we'll just rinse it. Okay, so first thing I'm gonna do before I cement the crown back in temporarily, I'm gonna take my 3D scan, because I'll get a better quality scan. And most of these crowns have metal in them, and they cause scatter in the scan, and it disrupts the quality of the scan. So I'm gonna take my scan first before I put the crown back in. Okay, go ahead. Yeah. So I'm gonna fit my post now. So I put it in my post hole, and I can see it's too long. So I'm gonna cut it again. So I've got my snippers. Okay. Try it again. Okay, that's good there. And then let me grab my crown. And then I'm gonna make sure the crown fits over top passively. Okay, so it's seating. And what's gonna happen is I'm gonna cement that post in with paracord, and then I'm gonna fill the crown with paracord and inject a little more. And then that loop is gonna grab the cement, and it'll just hold it all in place. So I'm just gonna go through the steps now for paracord. A little more.
Did you want me to feel this?
Yeah. Okay, you're good. Good. Okay, and our tooth is back in place. All finished for today until we do the implant. This technique can also be done with bridges as well when they fail. So you can see the same thing here. I've got my posts and they're fitted in place, and then my bridge is ready to cement in over top. And this is a great temporary solution to buy you and the patient time until they're ready to do their implant surgery.